Most of us feel uneasy about snakes or mice. But for phobics, it's not just a question of disliking something. Their fear has grown into such a distress that it affects their normal behaviour. They may have serious symptoms of pain, dizziness and nausea, feel they are short of breath or have shaking limbs. This fear may be triggered by the mere sight of animals, people or things like insects, dentists or utensils. Freud was the first to attempt a systematic description of the development of phobic behaviour. The onset of social phobias generally takes place during adolescence, when social awareness and interaction are evolving. Cultural influences also play a role, as well as genetic factors. In fact, parents of social phobics are more likely to develop major depression. Family difficulties, conflicts, frequent family moves, physical and sexual abuse in childhood are all factors generating phobias. Socio-cultural variations in social phobia are beginning to emerge and receive more attention. Findings suggest that there are similarities in the expression of social phobia across cultures. Phobic conditions are frequently manifested by a reluctance to interact, usually from childhood. Recent studies have proved that there are physiological factors such as conditioned fear responses produced by a disorder in the neural circuitry centered on the amygdala. The amygdala may function as a protective brake during evaluation of a potential threat, and it has been suggested that social anxiety may involve a deregulation or hyperactivity of the amygdala evaluative process. Family studies have shown high rates of social phobia in offspring or other close relatives of sufferers of social phobia. This suggests that social phobia is somehow familial and possibly specific in its transmission. There are also parenting and family environmental factors. Obsessive controlling and overprotectiveness can play a role in causing phobic conditions. Parent modelling and restricted exposure to social situations have an effect on the development of social phobic parent-child reinforcement of each other's anxiety. Compulsive washing is a phobia-like condition, and so is agoraphobia, the fear of being in public places where there are many other people. Treatments are complicated, and phobics get limited help from the medical establishment. However, there are self-help groups like Phobics Together, in which sufferers learn to ease their anxiety and thus reduce symptoms by sharing experiences. There are also special training programs implemented by psychiatrists and psychologists